So the next question is, 7-year-old child had fractured his maxillary central incisor 5 months ago, right? Now the pulp, it shows no response. No response means that the pulp is non-vital, okay? This is the word that we use for non-vital pulp, and there is no periapical lesion in the radiograph. Now the treatment choice is it apexification, apexogenesis, direct pulp capping, or is it indirect pulp capping? So let's first understand all these treatment options and then see what our answer is. So first, let's talk about apexification. What is apexification? Now, by definition, it is a method to induce calcific barrier in a root with an open apex or the continued apical development of incomplete root in teeth with necrotic pulp. So, the indication is that it is used in non-vital teeth with open apex. So one thing is clear, that apexification is a modality that we only use in young permanent teeth. And when do we call a teeth young permanent teeth? When the teeth has newly erupted and you know it has these open apex. As you can see in this diagram, the apex is open. It means it is not closed, which means the tooth is not fully formed in a way, you can say, right? If in this condition a tooth has undergone any trauma which results into a non-vital pulp, please note that apexification is only done in non-vital pulp, right? For vital pulp, we have different modalities. So two things are important. First, open apex, and second, non-vital teeth. These are the two things that need to be there in order for us to consider apexification. So the materials used are calcium hydroxide and MTA. These days, MTA is more commonly used than calcium hydroxide. Why so? Because when we use calcium hydroxide, actually, what we do is when the patient comes to us, we put calcium hydroxide medicament as a treatment plan. Now we wait for around 6 to 8 weeks to see the calcified bridge that has formed here because of the calcium hydroxide. But the problem is it sometimes takes as long as 6 to 8 months. So in a way, there has to be two sittings. The patient first comes and we put in the calcium hydroxide. Then we have to wait for around 2 months for this calcific bridge to form. Then we again re-enter and again permanent restoration is done in the tooth. So it's kind of a long process, right? But for MTA, the process is direct. Just fill the MTA at the apex. There is, you can say, 3 to 5 mm barrier that is placed at the open apex, right? So we put the MTA and the barrier is formed on its own. We don't have to go for a second filling. You can just fill the apex with MTA barrier, right? Just plug in this MTA barrier here and then just put your permanent restoration and we are good to go. So in one sitting, MTA can be done. So this is the advantage of the MTA. Now, see this diagram here. You can see open apex in this tooth. So now we have to put the MTA barrier in the open apex. You can say 3 to 5 mm of plug of MTA barrier is used. After it, the tooth is obturated, right? And this is the follow-up. As you can see here, how the apex has been closed now, right? This is nothing but apexification. It's not that the tooth forms. No, the root doesn't form because the pulp is dead. So now no more root will form here. What happens is that the apex closes because of the MTA plug. So this is what is known as apexification.